Hi, for those of you that don't know me, I'm Carly Wallace. I'm a pelvic floor physiotherapist. Today we're going to talk about why you probably don't need surgery for your bladder leaks, why that is, and what you can do instead. Don't forget to hit the subscribe button on the corner of the screen so you don't miss any new videos. Bladder leaks can happen for a ton of different reasons. One of those reasons could be bladder prolapse, which they can do a surgery for. If it's any other one of those reasons, a surgery is not going to help you. Now, let's look at some of these other issues. Okay, here's our bladder leaks in the middle. There's 7 main issues that I like to go through, and then also other little underlying issues as well that can be contributing. Did you know that we have a reflex within our pelvic floor? Our pelvic floor reflex is supposed to reflexively contract our pelvic floor when we do things like cough or sneeze or jump. If your reflex is not working properly, that can be a reason behind your leaks. Your posture really affects how your pelvic floor sits in your pelvis. If your posture is off, that can really affect how your pelvic floor is able to work for you. Tension. Your pelvic floor muscle is a muscle that can get tight. Not just weak, but also tight. It's sometimes a tight muscle that causes its inability to work or function for us correctly, causing leaks. Strength. Of course, we know strength can be an issue. Our pelvic floor muscle can be weak. A weakness in our pelvic floor muscle can be a reason why we'll get leaks. Our glute strength. Our glutes are a muscle that surrounds our pelvis. It helps to provide stability in our pelvis. If they're weaker, our pelvic floor has to work harder to make up for that, making it unavailable to work for us when we actually need it. Our breathing pattern. Our pelvic floor is supposed to work with our diaphragm, which is our breathing muscle. Some breathing patterns cause you not to use your diaphragm anymore. That causes your pelvic floor to get confused, and then whammo, we start leaking because it's not sure what to do anymore. And then lastly, our lower abdominals. If your lower abdominals are not working the way that they should with your pelvic floor in their coordinated way, it will affect greatly how your pelvic floor is able to function for your body. There are many other little reasons that stem off these reasons. One of these reasons is prolapse. Prolapse being an issue that they will do a surgery for to try to correct for bladder leaks. You don't have to have the surgery, even with bladder prolapse. There are many other things you can do. Let's have a closer look at our pelvic floor to see what's going on. If you want to know which of these underlying reasons applies to you, click on the link in the description. It'll take you to my free webinar where we're going to go through each one of these 7 factors one by one. You can try the tests on yourself to see which ones apply to you. So let's have a look at our pelvic floor. Our pelvic floor is a bowl of muscles that sits in the very bottom of our pelvis. Its job is to support our organs that sit on top. Here's our bladder here. Here's our uterus. Here's vagina, and here is rectum. Here, this red is your pelvic floor as that big bowl of muscles that sits in the bottom. There are 3 exit points. Here's our urethra, where we pee out of, has to go through the muscle. Our vaginal canal goes through the muscle. Our rectum also goes through the muscle. So it can have a lot to do with any of those 3 things. You've heard of a Kegel. What a Kegel is a contraction of our pelvic floor where that muscle will squeeze and then lift up, and then it drops down to relax. What a prolapse is, or a bladder prolapse, is when the walls of your bladder are starting to fall into the walls of the vaginal canal. You might feel some pressure down on your pelvic floor from that, and that will cause our pelvic floor sometimes to give us some bladder leaks. Now, the good news is you can also do some strengthening of your pelvic floor to try to help that prolapse out and prevent the surgery from happening. We also want to look, as I said, at all those other underlying reasons why you might be having bladder leaks. What they do in the surgery is generally a sling surgery where they're slinging your bladder back up so that it's not falling down into that. If one of the reasons causing your bladder leaks are from some of the underlying reasons, slinging that bladder back up will not necessarily solve your leakage. And that's why it's important to get to some of those underlying issues. Now, the success rate for a sling surgery is not really great. The 5-year success rate is not ideal. I think around 30 to 40% of those surgeries will fail within the first 5 years. Now, if we look at the statistics behind doing some pelvic floor exercises and getting your pelvic floor on the right path, is over 80% effective at resolving your bladder leaks. One of the biggest problems I see with prolapse and bladder leaks is unnecessary pressure. And what I mean by that is our pelvic floor is supposed to, when we cough, when we sneeze, when we lift something, when we stand up and change positions, it's supposed to contract for us automatically. A lot of the times that stops working for us for whatever reason. Sometimes it's back pain, sometimes it's poor posture, sometimes it's pregnancy and childbirth. Those muscles stop functioning how they're supposed to. Now, that ends up causing unnecessary pressure down into our bladder, down into that prolapse, down into that pelvic floor. You don't even know that you're doing it. Our pelvis will either find stability by contracting our pelvic floor or by pushing down onto it. Every time you cough, if you're pushing down as opposed to lifting up, that's going to cause leakage and pressure on your prolapse. Every time you lift, if you're not lifting up, you're pushing down, that's going to cause leakage, pressure on your prolapse, and so on and so forth. If we can get your body functioning again and your pelvic floor functioning again in the way that they're actually supposed to, we're going to get rid of all of that unnecessary pressure. We're going to get rid of a lot of those prolapse symptoms. We're going to get rid of most of that leaking. Click on the link in the description to take you to my free pelvic floor webinar. It's going to talk all about your pelvic floor, teach you exactly what's going wrong with your pelvic floor so you can really get to those underlying issues, avoid surgery, and get your bladder leaks on track. Send me a comment below if you found this video helpful.